station now, Network for All, in short, CNN4All.
In Bethel House of Refuge, Muhammad, Illinois, USA presents this week's breaking news in wellness and health for all people and all professionals. I'm the Pete of Dr. Z and Pete. I am the president of Bethel House of Refuge in Muhammad, Illinois. Dr. Z here is the CEO of CNN4All International. Previous to this experience, I was president of a commercial construction company operating in central Illinois. My wife, Stephanie, and I live in Farmer City. Stephanie is a travel specialist with the University of Illinois in the electrical and computer engineering department. This fellow right here at my left is my good friend, my distinguished co-host, Dr. Alex Raymond Zachariah. Doc is a doctor and a medical professor, as well as the CEO of CNN4All International. He was also the medical director at Provena, now Presence United Medical Center in Danville, Illinois in 2008 and part of 2009. As well, he was the dean of one of the top 12 medical schools out of 300 medical schools in India, Christian Medical College, Ludhiana, India. Doc, with his wife Prema, also a retired physician and a professor, spent 43 years at Christian Medical College in Ludhiana, first as medical students, then as faculty, until they retired in the year 2000. They now reside in Urbana, where they've been since 2005. Doc, great resume. We're glad to have you here as our resident expert, at least until Dr. Ross gets here. For this week's breaking news in wellness and health, I need for you to explain to the folks what we're all about here, what we're doing here.
Please note, this is not medical advice. This is for your information only. Do not change your treatment based on this info. You may mention this to your physician. You may even watch him, ask him to watch this.
Yeah, tell him what you're looking at. Ask him to weigh in on what we're seeing. If you want to contact us or your physician, you can do it by email. Breaking news at CNN4All.com. That's breaking news at CNN4All.com. Well, we're going to jump right into it. We're talking about cardiac issues. Young people now at higher risk for stroke. 15% of the most common type of strokes occur in adolescents and young adults, and more young people are showing risk factors, Doc, for such strokes.
This is according to a report in the journal Neurology, the top neurology journal, 2013. Between 500,000 and close to 1 million persons aged 18 to 44 in the United States have had a stroke. The impact of stroke in this age group, 500,000 to 1 million, is devastating. As will be adolescent and young adults, as a family, society.
Yeah.
So these are ischemic stroke, meaning they are caused by blockages, and more young people have risk for ischemic strokes, and they have high blood pressure, diabetes, obesity, abnormal cholesterol levels, and congenital heart disease. So this is coming on, affecting the younger and younger.
Yeah, and they're smokers too. More smoking.
That makes it worse.
All of that affects your health, most particularly in the area of stroke.
Yes.
In mild strokes, ultra-early treatment may eliminate the risk of disability. In the case of mild or moderate strokes, now you can get really severe ones, but mild or moderate strokes, getting treatment ultra fast within 90 minutes of experiencing first symptoms greatly reduces the risk of suffering disability.
That's the very important issue. This was published in the American Heart Association's journal Stroke, 2013. The study found that survivors with mild to moderate strokes who were given the clot-busting drug in the first 90 minutes of the recommended time window had little or no disability 3 months later compared to those who were treated between 90 and 270.
That's 4.5 hours. That's the window that's open, so you better be aware of that.
Yes.
If you know, what are those signs, Doc? Isn't it on
yes,
the left side,
that's
slurring of speech?
Yeah, we are covering in another one.
Good.
It's a big one.
Good.
Yeah.
Oh, check this out. You have a brain injury, you may be at higher risk for stroke. People who've had traumatic brain injury may be more likely to have a stroke in the future. My son had a TBI.
You have to be careful. The research was published in Neurology, 2013, the Medical Journal of the American Academy of Neurology. The study from the University of Michigan and Ann Arbor VA healthcare system analyzed 500,000 cases of traumatic brain injury, TBI, and found that people with traumatic brain injury were 30% more.
That's high.
1/3 more likely to develop a stroke than with those with trauma with
I'm
no
going to be communicating this to my son because he had a pretty severe
Yes.
head injury. Up to 15% of transient ischemic attack patients will suffer full-blown strokes within 3 months. Each year, as many as 500,000 Americans experience a mini strokes called transient ischemic attacks, TIAs. My dad had a couple of those. Those symptoms quickly go away, usually within an hour, and many people don't even seek treatment.
They
A
must.
wrong response.
Yeah. Loyola University Medical Center in Chicago, neurologists from Chicago published their findings in the journal Expert Review of Neurotherapeutics 2013. Rapid evaluation and treatment of transient ischemic attack, TIA, either in the emergency room or in specially designated TIA clinics can reduce the risk of subsequent strokes. So very important that they 90 minutes.
Yeah, don't blow it off.
No.
Just because symptoms seem to disappear. How about this? Clogged heart arteries can foreshadow strokes. Blockages in your heart arteries could mean you're more likely to have a stroke even if you're considered low risk.
Yeah.
Wake up.
The arteries are all over, so if it's blocked in one side, it could. The study from the University Hospital Essen in Germany, published in the American Heart Association journal Stroke, 2013, the heart attack patients who suffered a stroke were about 65 years old, had a higher body mass index, and were more likely to have high blood pressure, diabetes, and high cholesterol level. So it's absolutely important that block in one area of the arteries can also affect. So we need to take good care and to take care of it. Oh, that's very important.
Well,
we are back to stroke. The whole issue, this is
cardiac
on stroke.
business. Stroke prevention surgery is less effective than medication. Lifestyle change, the final results of a stroke prevention study in patients with narrowed brain arteries confirmed earlier findings. Medication plus lifestyle change. We're talking about diet, behavior, exercise, right?
Yes, yes.
Are safer and more effective at preventing stroke than a surgical technique called stenting.
Again, stenting of the carotid. The study was published in the journal Lancet, the 2013, and the study proves that medical therapy is better than surgery for these patients. This is extremely important that the lifestyle changes, eating and the exercise. All right, we continue on strokes. The whole we are focusing on stroke.
Right. Okay. Review on aspirin to treat and prevent heart attacks and strokes was published in the American Journal of Medicine of 2013. More ways to avoid stroke.
All patients suffering from blockage of an artery in the heart or brain should receive 325 milligram regular aspirin promptly and daily aspirin thereafter to reduce their death rate as well as subsequent heart attacks and stroke. That is 81 milligram daily. Besides statins to lower cholesterol and the multiple drug therapies to achieve control of high blood pressure. So
keep in mind, this is information.
Yes.
We're not telling you to rush out and buy aspirins or statins or whatever. You have to do this in consultation with your personal physician.
And they would be on it anyway. But this confirms what the physicians are doing is absolutely right.
Okay, now we talk about this with heart attack people and depression. Almost 8% of U.S. stroke survivors may have thoughts of suicide. Nearly 1 in 12 American stroke survivors have contemplated suicide or wish themselves dead.
The study was presented at the American Stroke Association's International Stroke Conference 2013. About 7 million U.S. adults have history of stroke. according to the American Stroke Association statistics. About 1/3 of the stroke survivors develop depression. But there is little data on suicidal thoughts.
Right.
The study found 7.8, or one out of almost 10% of stroke survivors reported suicidal thoughts, compared to 6% of heart attack survivors, 5.2% of diabetes patients, 4% of cancer patients.
Don't you think that if somebody has a debilitating stroke,
Yes.
that it affects their mobility?
Yes.
A lot of times their ability to do things for themselves, and
That's
it's
it.
really more traumatic. A lot of times heart attack or cancer is
Right.
internal and you really
That's
can't
it.
see it.
That's
But
right.
the stroke people,
Yes,
yeah,
that's
you bet.
correct. Yes.
Listen to this, Doc. It says eating too much salt led to 2.3 million heart-related deaths worldwide in 2010. Eating too much salt contributed to 2.3 million deaths from heart attacks, strokes, and other heart-related diseases throughout the world. That's a lot of people dying from eating salt, representing 15% of all deaths due to these causes. 15% have more due to too much salt consumption.
This was presented at the American Heart Association's Epidemiology and Prevention, Nutrition, Physical Activity and Metabolism 2013 scientific sessions. Ukraine, Russia, and Egypt had the highest, and Qatar, Kenya, United Arab Emirates, the lowest.
Oh my goodness.
Yeah.
Well, it said the U.S. ranked 19th out of 30 largest countries with 429 deaths per million adults due to eating too much sodium, representing 1 in 10 U.S. deaths due to these causes. My goodness. Okay, I think what it's saying to us is we have a whole lot more to do with living and dying than previously we thought. Living longer, living healthier. People are remaining healthier later in life. That's great news as I move into later life.
Yeah.
A new study shows that even as life expectancy has increased over the past 2 decades, Doc, people have become increasingly healthier later in life. That's you and me,
Yeah.
exercising,
Yes.
whole grains and rye.
And people are healthier than they used to be. The period of time in which we were in poor health is being compressed until just before the end of life. So where we used to see people who are very, very sick for the final 6 or 7 years of their life, that's now far less common. People are living to older age, and we are adding healthy years, not debilitated years.
You betcha. Well, I tell you, Doc, there's we were talking about stroke this time. I know of a young lady that's now 18 that had a stroke when she was 2 years old.
Ooh.
And treatment, you could see
Yes.
it's affected her movement, her modality, and all of that. And so I tell you, we cannot overemphasize the need for all of us to pay attention to what we eat, our exercise. Mechanisms, and how we do that. And we really need to get serious about our own wellness and health. Well, we'd like to thank you all for watching us. We'll be back soon. I did hear Dr. Ross out there, didn't I?
Yes.
Okay, our resident expert, our more distinguished expert, is going to be with us in a moment. And he may have laughing gas with him. We'll be right back.
Every day, thousands of people are diagnosed with macular degeneration, a disabling eye disease that leads to severe vision loss. As a scientist conducting research for the American Health Assistance Foundation, I want you to know that there is hope that a cure and new treatments for macular degeneration will soon be found, but only if we can continue our groundbreaking research. Learn about my research. Call 1-800-437-2423 or visit ahaf.org.
Compassion Now Network for All, in short, CNN4All, Urbana, Illinois, USA.
And Bethel House of Refuge, Muhammad, Illinois, presents this week's breaking news in wellness and health for all people and for all professionals. Hi, I'm the Pete, you remember me, of Dr. Z and Pete. This is Dr. Z, Dr. Alex Ramos Zechariah. He is a medical professor and a medical doctor. Good to have you here, Doc. We appreciate your medical expertise.
How about me?
Well, lighten up there, Doc. We're coming. This is Dr. Ross Shoha. He is our guest for our panel discussion and a more distinguished expert.
You got it right.
Yeah, I had some laughing gas.
I'm not distinguished.
No,
Well,
you're distinguished, but he's more distinguished.
Okay, see, you got it right.
Yeah, his agent added us to add more, right?
Mm-hmm,
Okay. Now you got some like affirmation issues, Doc?
Absolutely.
Yeah, I knew that. Okay, today our panel discussion is going to be on stroke.
Stroke?
Do you know anything about
Yeah.
strokes? Ischemic?
Yeah.
Huh?
I like to stroke you.
Oh, yeah. Yeah, well, that's not working. All right, here's what I heard. This is what I've heard through our discussions, some of the information we've had, that young people are now at a higher risk
Oh, you're
of
talking about
stroke.
medical stroke?
Yes, medical stroke.
Okay,
yes.
not about that.
Yeah, don't quit your day job.
Okay.
All right, talk to me about stroke in young people, Doc.
Oh, come on. You know what? How many 500,000 young people?
Oh, my.
Young people.
These are adolescents?
And a little older, they got stroke.
My goodness.
You know, stroke used to be diseases of the elderly, the older. Now, all their diseases, adolescents and young got it, like diabetes, obesity, and what? You know, hypertension.
That seems to suggest that some of the food that's being consumed and the fact that we might be producing a generation of couch potatoes that don't do anything but click their little Xboxes or their machines might be contributory. What do you think?
They exercise only their thumbs.
Yes, or their mouth.
No, exercise more. Walk, jog, run,
Yes.
treadmill, elliptical, till soaked in sweat.
I was hoping I could get you to sing that.
Exercise
more.
5 times a week.
5 times a week.
Yes. Half hour or more, till
Till
soaked in sweat.
Sweat. That's me, buddy. I'm there. All right. When you have a stroke, early treatment, how critical is it?
It's the most critical. It has to be 90 minutes or less. As soon as you get the TIA, you know, I'll cover TIA symptoms with him another time.
Okay.
Okay.
But you're saying the window of treatment is what? 90
minutes
what,
and
4.5 hours?
Yeah, if it is more than 90 minutes, the delay to dust, you know that clot need to be dusted, just like the clot in the heart arteries need to be dusted.
So you're talking about a
That's right, carotids.
carotid.
And their main branches.
So if you have a clot there, you got 90 minutes to get rid of it, or what happens?
Even inside, you know, through the carotid, they get
Isn't
inside.
it like, don't you have movement issues, slurring speech,
That's
those type
right,
of
that's
things?
right,
And
all these.
it could be permanent if you don't get it treated in time.
90 minutes or less.
Okay, 90 minutes or less. You need to get with it. Do not ignore symptoms. Isn't that what you're saying?
Not at all.
Even if they appear minor.
Absolutely.
All right, I need you to talk to me about that TIA, Doc, because that is like it appears to be a stroke. If I'm assessing it correctly, you have stroke symptoms, but they tend to disappear quicker. Is that right?
Transient ischemic attack, you know, momentary loss of a slight dizziness and facial asymmetry and slurring of speech. Anything, even if it is mild, hey, that's a warning sign.
Yeah. Well, my dad had 4 or 5 of those TIAs, and he behaved just as if he was having a stroke. And while he was in the emergency room, he got his speech back, he got his movement back. But you know what? He didn't make many adjustments in his diet.
That's the key. You need to make adjustments.
You bet. Now, if the TIA would be like a chunk or a little piece of a clog coming off?
No, it is platelets, you know.
Platelets?
You know, clumps of platelets going in and showers, the meteoric shower, these clumps of platelets causing temporary drain dysfunction.
So what they do is impede the blood flow
Yeah,
to
that's
the
right.
brain,
That's
right?
a warning, kind of
Okay.
warning. A warning.
All right, now here's another thing that I heard, and I'm sure with all your vast experience that you could answer this. And I heard that a traumatic brain injury, TBI, could be an indicator that you are at a higher risk for stroke later.
Yeah,
Is that true?
that's an very important study that came. Those who had any type of injury, mild or major, must watch out for stroke later in life. Do you have anyone in life?
Well, my son had a pretty traumatic brain injury where he was bleeding out the nose, the ears, and the mouth. And they said he had about a quarter-size fracture in his skull and a quarter-size hematoma.
That's a lot of injury.
Oh my goodness. So I'm going to tell you, when I get out of here, I will be talking to him about diet, and he's very good at it, diet and exercise. So that's a good sign for me.
That's very important,
Yeah.
both diet and exercise. Okay, go ahead.
All right,
And
so that's
also that he needs to watch out for transient ischemic attacks.
Okay.
Slurring of speech.
TIA.
TIA, transient
Okay.
ischemic attack. I mean, forget about the word slurring of the speech,
Okay.
asymmetry of the face.
Like this, where it drops.
Slight asymmetry.
And then
A
maybe
drop
on the left side.
and slurring of the speech.
Okay.
We will cover that at a later.
All right.
That's
Okay,
right.
good.
We both will cover.
Thanks, Doc. I appreciate both of you. All right. So what about clogged heart arteries?
Oh, clogged heart arteries and clogged drain all go together. Mm-hmm. They are cousins.
Okay, so that the fact of the matter is then if you have arterial problems around the heart, clogged arteries, restricted
That
movement.
means heart attacks.
Yes, okay.
Angina.
Okay,
Heart
right.
failure.
How about AFib?
Everything.
Okay,
Anything.
so those would be indicators that you need to pay attention in case of an elevated stroke risk. Is that right?
That's right. That's a very good German study that came that shows that those who had heart attacks are likely to get strokes.
Oh my.
That kind of makes sense.
So we, just because you have a heart
need
attack.
to, that's right. You need to watch the diabetes and obesity. Obesity is a disease.
Really?
Yeah, obesity.
A disease?
American Heart Association classified this year obesity as a disease.
My goodness.
Diabetes made worse.
Diabetes made worse?
Yeah,
Because you're obese?
hypertension, stroke, heart attack. We must all treat ourselves.
That means stop eating, right?
Yeah, we must all treat ourselves. That's right.
Okay.
And, exercise daily, 5 times a week. More daily.
Oh, my.
Walk, jog, run, diet, treadmill, elliptical, till you are soaked.
In sweat.
Yeah, you're soaked in sweat.
Yeah, you make me nervous, that's all.
Well, I know you exercise a lot.
Actually, your agent makes me nervous. And yes, I do exercise. I run from the couch to the refrigerator.
No. See, when you went to Florida, you ate well,
Yes.
you ate fresh, and you ate green.
Yes, and nuts.
And go nuts on nuts.
Right.
Oh, that's right.
Okay, no advice about eating? You ain't got any?
That's right.
Come on.
Yeah, you know what?
What?
Eat more.
Eat more?
Yes, eat more.
I was trying to eat less.
More all veggies, whole grains, fruits, go nuts on nuts.
Oh, yes. Okay, that's great.
Eat less.
Less?
Yes, eat less.
Mm-hmm.
Less of fried fruit, starch.
Yes. Sugar.
And sugar. Say no to soda,
What you're saying then is eat more and eat less, which is good advice.
Very good
More
advice.
fresh fruits, vegetables.
When you went to Florida,
Nuts.
you ate fish, healthy.
Oh, yeah.
And you ate veggies.
Oh, you know what
and
I did?
Green veggies.
I did have a ribeye.
Oh, that's okay. That's okay.
Now, it was lean.
It was lean
Yeah,
and
it
that's
was
okay.
good. Man, you'd have liked it, Doc.
Enjoy all you enjoy. That less.
You bet. And bicycle.
You bicycle.
You bet.
That is wonderful.
Yeah. So I'm thankful for the information you're giving out. This stuff affects almost everybody in every walk of life, especially the way the diet.
Can you both sing?
Who, me?
Yeah,
You
want us to sing? Yes.
If I sing, you may be out of a job.
Oh, no, don't you know what?
All right. What do we eat more?
Eat more.
Yes, eat more.
More of veggies, whole grains, fruits. Go nuts on nuts. Hey, you
See
don't
what I
sing
mean?
well.
That's right.
You're going to kick me out from my
Well,
job.
they'll just want us more.
Eat less. Yes, eat less. Less of fried food, starch, sugar.
Say
no to
soda, Diet Coke. Don't want any.
Exercise more.
Exercise more.
5 times a week.
Half hour or
more
till soaked in
sweat.
Yeah.
Exercise more.
Walk, jog, run, bike.
Treadmill,
Elliptical,
elliptical,
till
till soaked
You know, you're not going to have to worry about him.
Sweat.
All right, we thank you for being with us. We also would like to thank Science Daily for all the information that we got, and our resident, more distinguished expert, Dr. Ross Yoha, for all that he brings to the table.
Thank you.
Thank Dr. Alex Rama Zachariah, who is our permanent expert.
You can't get rid of him?
No, I'm not getting rid of him. You'll go before he does, so stop asking about it.
Okay.
Also, we'd like to thank the UPTV production coordinator, Jason Liggett, our production intern, the one and only 3-camera, Jacob Bernard.
Congratulations, Jacob. You are
You
doing
bet.
a good job.
He's not taking you to dinner either.
Okay.
Okay, and our intern, Caleb Serpenis, and the UPTV station manager, Jake Schumacher. Thanks, fellas, for all you do for us. Also, we'd like to thank the Chorister Fellowship in Tiruvala, Kerala, India, for the music score and that great big hallelujah, ending. So we say hallelujah, thank you, have a wonderful Christmas, and we thank you all for watching. We'll be back soon.
Thank you.